Hello everyone, and welcome back for those of you that have joined us in the past for our webinar series, Keeping Well for Health and Care Workers. For those of you that this is your first webinar, welcome. My name is Emily Gardner and I'm a cognitive behavioural therapist and I work for the NHS in London. And we're really excited to have you here with us for this webinar focusing on burnout and anxiety. Before we get started though, I want to show you the Q&A function which we're going to be using throughout today's webinar. Firstly, how you use it. So to click on the box with the question mark for the Q&A, and then there's an option to enter your name and it should come up on the right hand side of your page. And you can click on the small arrow, small box by the blue arrow to remain anonymous. Our preference would be that you do this as we can then keep your information confidential. And then enter your question and click on the arrow to send. So throughout the webinar, we're going to be asking you questions and we would like you to respond using this function. So even though it says ask a question, it still does the same thing if we're asking you a question. We will also ask you to respond to a poll. And so in order to do this, you will need to scroll up through the comments and find the relevant options A, B, C, D or E and click like. So click on the thumbs up button to select the option. If you have a question for us, then please add your question in here. Everything you write will not be published immediately as it needs to be approved by a moderator. So it may take a few moments to appear. And we're unlikely to be able to answer all questions, but we'll answer as many as we can in the time that we do have. If you wish your question to remain private, and then if you please write that at the front of your question, then it will just be kept private between you and the moderator and it won't be published. So hopefully that's clear and you know how to use it. So let's have a go. Our question to you is, where do you work and what is your role? So without giving us too much information about who you are, just let us know what roughly your role is and where you work, what kind of job you do. And that'll just give us a taster of who's on our webinar today. So I'll come back to those responses shortly. But we wanted to let you know what this webinar series is about, especially for those of you that have just joined us for the first time today. So this is just one episode of a series of 4 webinars, which we've designed to help you to cope with the impact caused by the coronavirus. And the theme of these webinars is different each week, focusing on the different ways that COVID-19 might be impacting on your mental health. And the first step in each webinar is always focusing on understanding why you feel the way you feel, and then looking at some strategies to help you to manage and improve the way that you feel as well. So let's have a look at what you hope to get out of the webinar today. So no, yes, no. I'm going to look at what your role is, sorry. I'm skipping ahead to the next question. So where do you work and what is your role? So we have a referral service manager from Enfield, a technical instructor in acute mental health, Hestia Housing, team leader of floating support team, health and social care assistant working with 65 plus patient in their homes, work for digital outreach comms in Somerset. So quite a wide range of different jobs and roles. Thank you so much for taking the time out to join us today. And I really hope that you find the webinar useful as well. So what do you hope to get out of the webinar? This is a question for you, just to get us thinking about the hopes that we have for today's webinar. And I'll talk to you more about the hopes and what to expect shortly. So this series of webinars is designed to provide you with a toolkit of evidence-based resources, ideas and tools that we hope will help you to manage the challenges that you're experiencing. And the content of these webinars is based on cognitive behavioural therapy, which is a very effective treatment for anxiety and depression. And the focus of CBT is to make changes to our thought process, but also our behaviours to improve the way that we feel. So what do you hope to get from this webinar today? So I'll have a look at your responses now. It's a bit slow today, so I will just see. Here we go. We've got a couple here. Strategies, tips and understanding. Lovely. That will definitely be something that we're going to be offering you. So some strategies for managing anxiety and worry. Ideas for myself, but mainly ideas to support students. Lovely. So it looks like you teach some biomedical science students, and you are hoping for some ideas to support them. Lovely. Some coping strategies, better coping skills for anxiety, just some potential coping strategies. I struggle with working home on my own. I find it heightens my anxiety. Lovely. Well, you're in the right place. All of you who've mentioned strategies for managing anxiety, that's what we're covering today. So really hope that they do help. We've got another one to help manage when I feel overwhelmed, and tools to help me keep focused and not let my mind go to a bad place or make up something worse. Lovely. Well, it's probably not lovely, but lovely that we are going to be able to offer you some strategies to manage those worries and that wandering mind and those anxieties that you're struggling with, which are quite normal and understandable given the circumstances that we're all in. So today's webinar, we're going to be hopefully giving you a good understanding of worry and how worry can be maintained, and also to help you to understand the links between your thoughts, your feelings, your physical sensations and your behaviours. But we also want you to go away with a knowledge of several techniques which will be useful to you to reduce your anxiety and your worry. So we wanted to highlight that right now we are all going through an incredibly difficult time. It has been an unprecedented time, and it's something that we've never been through before. And as a result of that, things do feel very uncertain and unpredictable, and like we have little control. So it may be that we're feeling more scared than usual, or that we feel like we have little control over our worries. We may feel stressed, we might feel low or anxious. You might even feel fine 1 minute or one day and then overwhelmed the next. And it's almost like we're on this roller coaster of emotions. And emotions like these are normal and to be expected, because we have had to make a lot of changes to manage the virus. And these changes have been absolutely necessary for our physical health. But unfortunately, they do have a consequence for our mental health, in that we are more likely to be worried and anxious and on edge as a result. And also the fact that we're at home more, a lot of us working from home, we're more likely to have time to think and worry about things, and our minds are going to get easily drawn into those worries and anxieties. Or perhaps we have increased financial worries and concerns, and that's something that that's impacting us as well. If you are really struggling, you may feel like you have nowhere to turn. So we wanted you to know where you could go if you needed immediate support. If you're having thoughts of suicide or of harming yourself in any way, then it's really important that you talk to someone about those thoughts and get support. The Samaritans are here to listen at any time of day or night, no matter what's troubling you. So you can call them for free on 116 123. Also, the NHS and the Samaritans have partnered together to offer a wellbeing support line for NHS staff and other healthcare workers, and that's available from 7 a.m. till 11 p.m, 7 days a week. So call them if you want to on 0300 131 7000. We've also put this information at the top of the Q&A, so if at any point during the webinar you do need these numbers, if you scroll to the top, you'll find them there. We will also provide more information at the end of the webinar about further support that might be available to you. So let's start thinking a bit about anxiety. Many people experience anxiety, and the symptoms of anxiety can make them feel concerned about whether there is something wrong with them. So, for example, symptoms like increased heart rate or breathlessness or feeling hot and sweaty, pins and needles, a knot in your stomach, those are all symptoms of anxiety, but they can be quite distressing when we do experience them. And these are just some of the many symptoms of anxiety. And although you may feel alone in your struggle with anxiety, many people experience anxiety on a regular basis, and it's estimated that 1 in 5 people experience excessive levels of anxiety in their life. It can affect anyone at any stage in their life. No one is exempt. Now, everyone experiences anxiety every so often. It is a survival instinct, and it has been designed to protect us from danger. And we call this the fight or flight response, which has protected us for thousands of years and has been passed down through our ancestors. So if we think back to when our ancestors were hunter-gatherers, they would be faced with the daily threat of a ferocious animal such as this lion drinking from their watering hole. And when we're faced with this kind of danger, this response is essential because it initiates a whole series of physical and behavioural changes that actually are designed to keep us safe. So when confronted with danger, we typically flee from that situation or we stand and fight. And the main purpose of this response is to protect the individual. So whilst it feels very distressing, it is not harmful in any way. As soon as that danger is perceived, the brain sends a message to our autonomic nervous system, and that activates the various areas of the body ready for action. So we're ready to fight or we're ready to run away. And as a result of that, we experience physical changes from head to toe. So when this happens, you may notice an increase in heart rate. This is to ensure that blood is pumped to where it's needed in the body. And because of that, it's trying to get oxygen delivered to where it's needed as promptly as possible. And that's why your heart's pumping faster, because it's trying to get the blood and oxygen around the body as quickly as possible. And whilst blood and oxygen is being sent to where it is needed, the large organs and muscles, it's being taken away from places where it isn't needed, such as your skin, your fingers and your toes. And these changes result in the skin looking pale and feeling cold. Perhaps you feel a bit numb and your fingers maybe tingle or your toes might be tingling, although that pins and needle feeling. You may also notice changes to your breathing, and this is very important as it's providing tissues with extra oxygen, and that can create feelings of breathlessness or even choking or smothering feelings or that tight feeling in your chest. And one of the main side effects of this increase in breathing is that the blood supply to the head actually decreases, as it's seen as not essential, but that can be producing symptoms of dizziness, lightheadedness, and blurred vision. So for all of these symptoms, there is a reason. And when we're experiencing, we're not necessarily thinking about the reason why we're experiencing the symptoms. We're just thinking about the symptoms, and it can be quite overwhelming and anxiety provoking in and of itself. But it's important to remember that anxiety is a healthy bodily response to threat, and it makes sense when there is a clear threat. So when we're faced with danger, it completely makes sense, and it's helpful in those situations where we need to react quickly. For example, if a car pulls out of a junction that we didn't see, it's really important that our body gets into gear quickly so that we can get out of the way of danger. And once that threat is gone, things return quickly to normal, and we don't think anything of it because we knew what the danger was, we knew why we were feeling anxious and energized, and it's because we were in danger. However, in our current lives, the fight and flight response can be triggered by everyday things where there is no obvious threat. So, for example, we may find that we break out in a sweat at our desk whilst reading an email, or maybe whilst watching the news, or maybe we're opening a letter that we thought was a bill. And so when our body responds that way, and there's no obvious threat, it can feel really overwhelming and distressing because we don't understand why that reaction has kicked in. So it can be really helpful to understand the cycle of anxiety and the different areas that contribute to it. So we call this a 5 areas model, and it's a really useful tool that we use in cognitive behavioural therapy to help us to break down that experience of anxiety and understand what's going on. So I have an example here. So at the top of this, we have the life events. So these are things such as increased workload or responsibility, the limited resources, or distressing scenes that we've maybe witnessed, or maybe living away. Maybe we've not been living with family or our community, or maybe we've been redeployed and we're working in a new and unfamiliar team. And so those life events naturally will have a knock-on effect onto this cycle. So we're more likely to have thoughts and worries about the virus. So what if I catch the virus from someone at work? What if I pass the virus on to a family member? Or it might be, why did I make that choice? We might be ruminating or dwelling on decisions or things we've done. And we might be questioning those decisions and wondering if we should have made a different choice. And those thoughts are quite distressing, whether they're thoughts about the virus or passing it on to a family member, or dwelling on making mistakes or choices that you should have done differently. Those are quite distressing. So they will lead you to feel a number of physical symptoms. You're more likely to feel tired and drained, breathless, muscle pain, loss of appetite, and loss of poor sleep, especially if you're worrying about these things at night. And that will have a knock-on effect on your levels of motivation. So that will then impact your behaviours. So you may spend a lot of time worrying or ruminating about things. You may find that you're withdrawing or avoiding things, or maybe procrastinating at work because it's really becoming hard to focus and concentrate. Maybe you're drinking more alcohol or comfort eating. And all of these areas will be knocking onto our emotions. So we're more likely to feel anxious. If we think about the thoughts that that we've got here, thoughts about catching the virus will definitely cause feelings of emotion. Doubts about our decisions will make us feel guilty. And over time, we may find, especially when we're starting to feel burnt out, that we might feel detached from our jobs, detached from life, and we may be feeling really frustrated and overwhelmed by things. So it's important to be aware of how this cycle can escalate, and they all knock onto each other. So we are likely to feel these more and more of these physical symptoms if we are caught in this cycle. On the whole, what we need to do is focus on breaking this cycle. And today we're going to talk about how we can tackle worry and rumination as a way of breaking into this vicious cycle and as a way of improving your mood. So we'll come to worry and rumination now. I'd like to think with you about some of your worries. And so what are some of the things that you are worrying or ruminating about? So have a think about the last week, the last month, about your worries and your concerns, and share them with me in the Q&A now, and we'll come to those more in a few moments. So while you think about your worries and concerns, I will talk through some of the things that you may have been worrying or ruminating about. So one of the challenges you may have been experiencing, it might be increased workload, and this might be because of other staff have been off sick, or maybe they're shielding, and so that has put an increased amount of pressure on you. Or maybe it's because where you work has a lot more people that you need to treat, more people that you need to look after and care for, and so that in and of itself is causing you a lot of worry. Or maybe it's worries about limited healthcare resources, or it's maybe the decisions of your team or your managers that might be causing you distress. Or maybe you've been having to make really difficult decisions. Maybe these are new responsibilities that you've never had before that are causing you a lot of worry and anxiety. Or maybe you're ruminating and dwelling on past decisions that you have already made, and wishing you'd made a different decision. Or perhaps you've witnessed some really distressing things and it's been really hard to deal with those, and that's had an impact on you as well. Or maybe you're living away from your family and community, and without that support, it's really tough, and you don't feel as supported, and you don't feel as that you're able to look after yourself as well without that. Or maybe you've been redeployed and you're working in a new and unfamiliar team, and not only are you having to deal with the impact of the virus and the pressures and stress of it, but you're also having to navigate a new working environment, which is really overwhelming. So let's come to some of your worries and ruminations. So I'm going to have a look now. I often suffer with intrusive thoughts when my anxieties increase, which can affect sleep and productivity quite dramatically. Yeah, that must be really hard when our worries and thoughts intrude into our lives and can impact our sleep and productivity. Not being able to see my family, absolutely. We're already maybe under a lot of pressure and dealing with a lot of struggles and challenges, and actually not being able to get that support from family members is really hard. I've definitely been procrastinating at work and at home, struggle with routine. Yeah, it's hard with a big change in routine. It's hard to not procrastinate, and it can be really hard when we're overwhelmed with worries and anxieties. It's then hard to focus and concentrate on our work. Feeling as though I let a patient down because the treatment wasn't perfect. And a number of you may be feeling this way, as you know, there have been times when resources were limited, whether your team were under pressure and staffing levels were struggling, or maybe lack of PPE. And it can be, or maybe it was a decision you made when you were under pressure and a choice you made during treatment. And it can be really hard to deal with that, because we might be dwelling on lots and lots of different things about what happened and how we dealt with things. And we're going to talk more today about how we deal with that kind of rumination and that dwelling. So we'll come back to that. Did I give the right advice to a patient? Did I do enough? So really a lot of questions about the past and dwelling on those things that we've made, those decisions that we've made, those things that we've done. Not being able to support my team, worrying a lot about the past and things you can't change, worried that my relationship won't last, not getting on since coronavirus, since I had the coronavirus 4 months ago, the impact of being unwell for a long time and how that significantly changes things. And there's a lot more, and I won't have time to go through them all today, but have a look through each other's answers, and like the ones where you've experienced similarities or where you've struggled with something similar, just to kind of share with each other those challenges. Unfortunately, we can't comment on each other's comments. I know that's something that we'd really find valuable, but at the moment with the platform we're using, they don't make that possible at the moment. So yeah, just like each other's comments and to give each other that support. So what is worry? So today we are going to help you to understand worry and rumination a little bit more, and then some strategies to help you manage those processes. So the process of worrying is a normal part of life, and it is something that everyone will do every now and again. However, worrying can become a problem when it takes up most of our time, and it starts to have an impact on our ability to get on with our lives. So we may find that our concentration and focus, or we're distracted by our worries. And we may even feel as though our worry is in control of us. So what we can look to do is not completely eradicate the worry, because as I said, it is a normal part of life. We will always worry about things. But what we need to do instead is learn ways to manage it. And then we can start to feel a little bit more in control of our worry and break into that vicious cycle that we talked about a few moments ago, and see those physical symptoms improve as a result. So what is the difference between worry and rumination? Because there is a difference. Our worries are future focused, about danger and our own ability to cope with things, whereas rumination is past focused and focus on loss and personal failings, so things that we did or didn't do or should or shouldn't have done. Worry often leads to anxiety, stress, fear, whereas rumination leads to depression, sadness, and shame. Worry often has a what if this happens, what if that happens, or imagining all of those worst case scenarios, whereas rumination is often dwelling on if only, or regretful, I should have or I shouldn't have. And so hopefully that shows you the difference between worry and rumination. However, when it comes to worry and rumination, we can deal with them in a very similar way. And we can think of our worries and rumination like a bubble machine. Hundreds of bubbles get fired out in all different directions, and we could address each individual bubble and pop it. But whilst we're doing that, more bubbles are being generated at a much faster rate than we can pop them all. So the best way is to actually turn off the bubble machine instead of trying to individually deal with each worry. The worry techniques that we're going to talk through today focus on turning off the worry or rumination process rather than dealing with those individual worries and concerns. The first step is to record your worries, so to write them down. So we have here an example worry record. So we start with the date and time, Tuesday 8 a.m, the situation, so where were you, what was happening, are you with anyone, and so eating breakfast with my family, and the worrisome thought that popped into your mind, what if I lose my PIN and I can't work anymore? And then your anxiety rating out of 10. So in this example, it was 8 out of 10. And then the next step is to identify whether it's a practical or hypothetical worry. Now, at the moment, that might not seem like much to you, but I'm going to talk to you a little bit about the difference between hypothetical and practical worries shortly. But it's really helpful to write your worries down, as it helps those abstract worries from going round and round in our heads. And when we put them down on paper, it makes them more concrete. And that can be really helpful to help us separate ourselves from the worry and stop that cycle from escalating. But also the most important part of it is identifying whether or not it is hypothetical or practical, because then we can do something about it. And we have these two main types of worries. We have those practical worries that we can act on, and hypothetical worries that we cannot do anything about. And hypothetical worries are often what if type thoughts about the future, and people who worry often find that they have a lot of hypothetical worries. So it can be difficult to put these thoughts out of their mind, which can then make acting on the more practical worries difficult. And rumination comes under hypothetical worries because these are things that are in the past that we cannot change, and there's something that has already happened. We can't do anything about it. And one problem that people who worry a lot often have is that they treat all of their worries in the same way. So if we think through and try to solve our hypothetical worries, then we may be left feeling really frustrated, as there is often nothing that we can do about those things because they may or may not happen. We may also find that because of that, we've spent all of our energy on these hypotheticals. We then don't have the time or confidence to actually act on those practical worries that we can actually do something about. So it's really important to have a go at classifying our worries when we have them. So we use that worry record, and then we write down our worries and work out whether or not they are hypothetical or practical. And it's important to remember that those hypothetical worries are still very difficult thoughts. So even though we're saying they're hypothetical, there's nothing you can do about them, they are still really distressing and worrisome. and they make us feel very anxious. But it's important to make that distinction about whether or not we can actually do anything about these worries in that moment. And if we cannot, then it is hypothetical, and continuing to go over and over it will only make us feel more anxious. Sometimes there is an overlap between our worries. So, for example, there might be a situation that we can do something about, but we are worrying about it at times when we can't do anything. So, for instance, at night when we're trying to sleep, these worries can intrude and we can find it really hard to fall asleep. Therefore, even though it's a practical problem, we can deal with it in the same way as a hypothetical worry, because we can't do anything about it right there and then. And so then we plan to deal with it tomorrow when we can work on it. So we can use this worry tree as a useful tool to help us to work out how to deal with our worries or rumination. And we can go through this process to get us to a strategy that will help. So we start by writing down our worries and asking ourselves whether we can do something about this right now. So if it's a yes, then it's a practical worry. Then we want to use a strategy called problem solving to resolve it. And the best thing to do when you have a practical problem is to solve it, because once you've solved it, you don't have to worry about it anymore. It's dealt with. Obviously, that only works if it is the daytime and there are practical things you can do right there and then. If you can't actually deal with something in that moment, then you can put it as a hypothetical, because it's not something you can actually do about right now. So if it isn't something that you can't do anything about right now, so this applies to hypothetical worries in general, rumination, because you can't do anything about something that's already happened in most cases. There are sometimes things that you can do when something has happened in the past, and we'll come to that later. And also if it's a practical problem that you can't do anything about right now. So if you can't do anything about it, then it's a no. It's a hypothetical worry. And the best technique and strategy to use for this is worry time, which we will talk about after we've talked about problem solving. So problem solving is a really useful strategy to help you to work through some of your problems. When we are feeling anxious, our ability to solve practical problems is hindered, and we can often feel frozen or fearful about acting on some of our problems. We might even avoid thinking about some of those more difficult ones. And that may relieve our anxiety in the short term, because we don't have to deal with it right there and then. But in the long term, this keeps these practical concerns hanging over us and feeding into our anxiety cycle. So by using this problem solving technique, we can get clarity on our problems and think about what our options are by planning how to solve them. And then we motivate that change rather than the avoidance. So the first step with problem solving is to clearly identify the problem and write it down. Then we brainstorm the solutions and try to get everything down that comes into mind, however ridiculous it might seem. And this will get your mind going so that you can start to come up with some feasible solutions. So at this stage, anything goes, and we don't rule anything out, because we leave that to the next step, where we then look at the strengths and weaknesses of each solution. And then based on the strengths and weaknesses, we can then select the solution that we wish to implement. But it's important to remember that it's highly unlikely that you will find a perfect solution. And often we can wait for a perfect solution, but actually one never arises. And actually what we're doing is nothing. We're waiting. And so we also need to weigh up the strengths and weaknesses of doing nothing, because often there are more weaknesses than strengths to not acting. And then we plan how to carry out that solution and try to break it down into as many steps as possible, and put that plan into place and keep a note of how each step goes, and then review your progress. If you face difficulties in implementing your plans, this can give us, if we don't review it, we can feel frustrated and hopeless that we're never going to solve this problem. Whereas if we've done problem solving and we've written it all down and we have it here, we can go back to step 2 and 3 and implement another solution. And then we can keep doing this until we solve the problem. So we have developed a couple of examples of how to use problem solving for you to look at. They're at the end of the webinar in the slide deck. So after the webinar, if you are going to try this strategy, then there's examples for you to try and have a look at. So coming back to the worry tree, we've shown you what to do if you have a practical worry and how to deal with those worries. And it is quite straightforward in that if you have a practical worry, the best thing to do is to solve it. And this strategy is really good for helping you keep going until you resolve a problem. However, if it's not a practical worry and there isn't anything you can do anything about it, then there's not much point in going over and over it and worrying about it, because all you're doing is causing yourself a lot of distress. And so it's important to classify it and label it as a hypothetical worry and remind yourself that there's not much you can do about it. And a technique that we can use to help us with this is a technique called worry time. So let's start with a bit of an experiment. For the next few moments, I don't want you to think about a pink elephant. So no worrying about or thinking about a pink elephant for the next few moments. This is a picture of a pink albino baby elephant. It is extremely rare, but no thinking about it. How did that go? I only let you do it for a few moments because it's often very ineffective. It's interesting in that with our hypothetical worries, what we often do is tell ourselves not to worry about something, and we try and push those thoughts to one side. However, as we've just seen with this experiment, this is often a very ineffective strategy. And the more we try not to think about a worry, the more we get this bounce back effect, and the worry comes back into our mind. So what is the alternative? So for hypothetical worries, a useful technique is worry time, where we postpone worries rather than just push them away. And postponing worries means that it is okay for an initial worrisome thought to be in your mind. It's understandable, it's normal, everyone has worries from time to time. But then you make the decision to not engage with that worry or chase the worry any further at that particular moment. And the process of not chasing worrisome thoughts further means that you don't try and anticipate all those worst case scenarios. And then you postpone those worries. So you've made that decision not to not worry about it right there and then, and you postpone it to your worry time. And we're going to talk about that now. So when planning your worry time, which is the first step, we need to plan it at the same time every day. Consider how long you feel is an acceptable period of time for you to worry. And at first you may feel like you need quite a lot of time, but over time, you might reduce the amount of time you spend worrying. It needs to be a time where you can set aside time for yourself to worry and not do anything else. So there are no other distractions, and ensure that you do turn off your phone or let people know if they can't disturb you. And to get most out of your worry time, have it the same time every day, no longer than half an hour where possible. Set a reminder for start and finish time, and have it in a separate room that you can leave once you're done. Step 2 is throughout the day, when you get the worries come up, it's to write your worries down. When you are worrying outside of that planned worry time, it's constantly identifying whether it's hypothetical or practical. And then if it's practical and you can do something about it right there and then it's resolving it and problem solving it. However, if it's hypothetical, then it's writing it down on your worry list and it's saying, I will deal with this later in my worry time. But then step 3 is refocusing on the present moment. So it's allowing ourselves to let go of that worry and say, well, it's hypothetical, I can't deal with it right now. I'm going to refocus my attention on the present moment, whatever I was doing before the worry popped into my mind. So if I was watching television, it's refocusing my attention, or if I was writing an email, it's going back to the email and refocusing your attention on that email. Whatever you were doing, it's refocusing your attention on that task. And then when you come to your worry time, you then are allowed to worry as much as you can within that 30-minute period. So go through your list of hypothetical worries and choose ones that you want to start worrying about. And for each hypothetical worry you have, consider how you felt when you wrote that worry down. So how did you feel it at that time? And how do you feel about it now? Has the thing that you were worrying about happened already? How did you deal with it if it has happened? And were there any worries that when you've come back to them no longer worry you? They're no longer a problem. Often people find that when they come to their actual worry time, they've had a bit of time and those worries are no longer as concerning to them. And then I want you to reflect on what it feels like to worry as much as you want for that 30-minute period of time. Did you need as much time as you planned? And if some of those worrisome thoughts that you wrote down are no longer a problem for you, then put a line through them. And then at the end of worry time, screw up the paper, throw it in the bin or burn it, whatever you want to do. It's always good to start each day with a new list and fresh piece of paper so that you can only focus on the worries that happened since your last worry time rather than a backlog of worries. So by setting time for worries, we gain back control. Rather than letting worries consume us every day, we can enjoy the present moment and then address those worries in that time that we have set. This reduces the overall time that we spend worrying. And it contains our worry to that specific worry time. And it teaches the brain that we don't need to worry throughout the day, as it actually serves no beneficial purpose. And this is what people who don't worry do. They acknowledge that it's a worry, but they also acknowledge that it's hypothetical and there's nothing they can do anything about. So they let it go. And right now that will be hard for you, but over time, the more you practice this, the easier it will get to let go of your worries. Worry time also helps us to tolerate the unknown. As we postpone it, we're saying, I don't know what's going to happen, but I'm not going to dwell on it anymore, and I'll deal with it when and if it happens. So we learn to tolerate that uncertainty. It also gives us perspective, as if it's no longer a worry by the time we come to worry time, we can then reflect on that earlier reaction of worry and anxiety. And also, if that same worry keeps coming up every single day, we soon learn not to respond as anxiously as we would have previously. And over time, people find that they do become desensitized to their worries, because if you write down that same worry every day for a few months, then you really learn that actually you get bored of it and it doesn't elicit that same emotional response. And the more we practice this, the better we get. And eventually you may not need to actually attend a worry time, because you can just accept that there's nothing you can do about it and it will likely resolve itself. So we highlighted earlier that we can deal with rumination in the same way that we would deal with hypothetical worries, because a lot of what we are worrying about has already happened and there is often nothing that we can do about it. However, some of the things that we are ruminating about might be difficult to let go of. So how does it affect us? Well, when we're ruminating, what we're trying to do is reduce the distress and overcome a problem or something that's happened. But what we end up doing is increase and prolong our distress and make the problem feel bigger. And it can really interfere with clear thinking, daily activity, our ability to cope. And it often leads to unhelpful behaviours to help us escape from our thoughts, such as self-harm, drinking, drugs, or comfort eating. The more we ruminate or worry, the stronger that habit becomes and the harder it is to change. The less we ruminate or worry, the weaker that habit becomes. So what can I do? Well, firstly, we need to notice that the mind is going down that rumination route. and tell yourself, I don't have to think about that right now. I can wait until I feel stronger. There's nothing I can do about my thoughts. I can't stop them, but I can choose not to focus on them. So do something that will take up your attention that might help you feel better. So ask yourself, what can I do right now that will help me feel better and be effective for this situation? Right now, what can I do that will take me one step in the right direction? You may also be dealing with some guilt. We often blame ourselves for things that have happened. However, we usually give ourselves more than our fair share of that blame and responsibility. So we can ask ourselves, how responsible do I currently think I am? And give yourself a percentage. And then think about all the other factors that may have contributed to this event and share some of that responsibility. So you can ask yourself, well, what were my actions? How much did my behaviour actually contribute to this situation? And then consider the actions of others. How much did the behaviour of others contribute to this situation? And then consider all those random, unpredictable factors. How much did bad luck or circumstances, such as the weather, timing, coincidences, lack of knowledge, illness, contribute to that situation? So what we do is we create a responsibility pie where we attribute a percentage of the pie to each factor that we've identified. And then we draw out lines out of the circle from the centre to mark off those different sections according to how responsible that part of that responsibility factor is. And then, so you leave yourself till the end. So you work out who's responsible for what and how much percentage you give to each. And then you leave yourself with what's left. And often that is a more accurate picture of how responsible you actually are. And then you go back to your initial percentage and you think, okay, I'm not as responsible as I was giving myself credit for. And there are other factors involved. I don't need to feel as guilty for this as I have been feeling. So hopefully for some of you who are dwelling on decisions or past mistakes or errors, it's worthwhile doing this activity to really work out how responsible you actually are. And in most cases, you're not as responsible as you are giving yourself credit for. And there are other factors that may have contributed to that. So our take-home messages today. Anxiety is inevitable. Everyone experiences anxiety at times, and it's normal and healthy. So write down your worries. Writing them down can get them out of your head and give you clarity, especially if you then go on to categorize whether those worries are hypothetical or practical. And have a go at problem solving, giving you clarity on your problems and helping you to work out what your options are. And if it's a hypothetical worry, then use worry time to postpone your worries rather than just pushing them away. And if you're feeling guilty for something that you've done in the past, then consider if you are as responsible for something that you think you are. So what I'd like you to do now is to choose one idea from the webinar today that you will action this week. So going into the Q&A, looking at the options, so we should give you these 4 options there. Like it so press on the thumbs up and choose whether or not you're going to try and record and categorize your worries, have a go at problem solving, or try out the worry time, or try out that responsibility pie to work out whether or not you are responsible for something. Also, if you do have any questions that you'd like me to answer, please add those to the Q&A now, and we're going to come to those at the end of this webinar. So if you would like to try this for yourself, this is a blank version of the 5 areas model that we went through at the beginning of the webinar. And there are some prompt questions here for you. If you're not sure what to put in it, this should help you work it out. So if ever you find yourself in a very anxious or worrying state, where you're feeling really overwhelmed, then get this out, and write down how you're feeling. So write down the thoughts that are going through your mind, write down the emotions, write down your behaviours and your physical symptoms. And this will help you to understand that process that you're going through. Here is an example of problem solving. So it's a specific example of struggling to cope with increased workload. And so this is to show you how to use it, but it may also be useful if this is a problem you're struggling with. And we also have some time management strategies, as this is part of the problem that we've highlighted in the problem solving thing, but these strategies may also be useful for you to try if you're struggling to manage your time. And we also have an urgent and important matrix. This is useful for you to understand and prioritise. So if you're struggling to prioritise your tasks and activities, then this can be really helpful for you to question those habitual activities, so things that you're just doing because you've always done them that way. It will help you to work out what's necessary for you to actually focus on right now. And I do talk about both of these a little bit more in our working from home webinar. So I will leave, there is a link for it in a few slides time, so that you can have a look at that if you want to in more detail. So coming up, this week we have one more webinar tomorrow. It's a BAME Wellbeing webinar, which is being hosted and presented with David Truswell, who is an expert in the area. And next week we have a Managing Financial Anxiety webinar, as well as a sleep webinar. Now, these are all part of our Coping Well During COVID series, but they might be beneficial for you as well. In particular, the sleeping webinar. We're not able to offer you a specific webinar next week, but we added the shift work part of the webinar we normally talk to you about as part of this series into that webinar next week. So we will be covering shift work and the impact of on sleep if you are in shift patterns. So come along to that webinar and register for them here. If you have witnessed or experienced some distressing things over the past few months, you may be experiencing a number of physical symptoms. You may be having flashbacks or nightmares. It may feel like you're reliving it all over again. You might find that you're having uncontrollable thoughts about the event. This is normal reaction to a traumatic experience, and these symptoms are often lasting about a few weeks. However, if it's been a few months since the event and you're still experiencing any of these symptoms, then it's important that you seek help. And these symptoms are easily treated with the right help. So our local IAPT services, IAPT service is basically a national service which is free across England, and they offer evidence-based support for post-traumatic stress disorder, low mood, anxiety and depression, and it is available over the telephone or online. So if you do feel like you need more support, then use this link and type in your postcode and you'll find your local IAPT service. If you feel like you need urgent help for your mood, we recommend that you speak to your doctor. If you're unable to or don't feel able to do that right away, then we recommend the Samaritans or the NHS and Samaritans Wellbeing Support Line, or Shout, who also offer a confidential 24/7 crisis text support service. So you can text Shout to 85258. If you're not sure what support you would benefit from, then the NHS Urgent Support Guidance might be helpful for you to work out what you might benefit from. We also have a number of links and resources here that you may find useful. So have a look through this and hopefully that will be able to benefit you too. We really do value your feedback and we'd love to hear your thoughts about the webinar today. So please use this link, which we're going to copy and paste into the Q&A now, so that you can click on it and it will take you to the survey, so you can fill that out now. And you can do that whilst we're going through a couple of your questions. So that is the end of the webinar. Thank you so much for coming along today and being involved in the webinar and interacting with us. What I'm going to do now is have a look at your response to the poll and see what you're going to try and do over the next week. And I can see that it's a tie between recording and categorizing your worries, and trying out the worry time technique. So well done, brilliant. So now to your questions. So I'm going to have a look and see if you've posted any questions, and I'll try and go through as many as I can in the final couple of minutes. So, how to manage when I'm overwhelmed with my workload all the time, feeling anxious about reaching deadlines, not being supported by my line manager, and also deal with pre-existing health issues. So there's quite a lot to go through there, but I'll try and get through as much as I can. So firstly, I would recommend starting with the problem-solving strategy of coping with your workload, because that sounds like a practical problem, is how can you work through your workload and manage your workload. So the problem-solving strategy in the webinar example actually has coping with high workload there, and it does have some really useful time management strategies. So you may be doing a lot of them already, and it may be that you do just have an unrealistic amount of work to do. And if that's the case, then it's problem solving how to get support with that. So I guess there's a few steps here. Firstly, problem solve what you can do to manage your time better, if that's something that you need to do. So try using both of the things in the slides, the time management tips and the urgent important matrix. That should be really helpful. Then if you've done that and it's still just a case of you just got too much work to do and it's not possible for you to do it, then it's problem solving how you talk to your line manager. And you may have done this already, but maybe it's about going to someone else and going maybe above your line manager and saying, I don't feel very supported, I have some concerns, etc. And then it may be focusing on problem solving your pre-existing health issues separately. So how can you look after your health better? How can you support yourself to do this workload? And kind of going back to last week's webinar about looking after yourself is a really key part. So if you haven't watched the Preventing Burnout webinar, then I really recommend that you do that, because if you don't look after yourself and your health, then you will not be able to continue with the amount of work that you're doing. So look after yourself. Even though you feel like you've got not enough time, it's even more important that you look after yourself. Hopefully that answered. Yes, the session is recorded, and you can find it on the Thrive London website, or click on this link here. And that is all of the questions. I think we've got one more about whether or not the fight or flight response is harmful. So we answered this at the beginning, so maybe you missed the beginning of the webinar, but the fight or flight response is not harmful in any way. In fact, the symptoms of fight or flight response are the same symptoms you get when you are exercising. Basically, it's just your body getting you ready to fight or flee a particular situation where your body and your mind thinks you're in danger, even though you might not be. It sends that signal that you are, and so your body prepares to fight or flee the situation. And so no, it's not harmful in any way. In fact, it's protecting you, or trying to protect you from danger and threat. So even though it feels distressing and overwhelming, it isn't, and it is not harmful at all. Okay, thank you so much for attending the webinar today. Really hope it's been helpful and you have some useful strategies to go away with and to try. And we look forward to seeing you at our final 3 webinars, which we have planned over the next week. All the best. Take care. Goodbye.